Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. I'm happy to be back with you again as part of our Friday video series where we give you updates about what's going on. Let's start today with some of the changes in the PA COVID restrictions. These were announced by Governor Wolf's administration on March 15th, and these are to take place April 4th, starting with alcohol service. So now restaurants can resume their bar service, including being able to sell alcohol without you having to buy food. In addition, the curfew as to when they could sell food has been lifted. On top of that, now restaurants' occupancy has gone up to 75% for those who are certified for their cleaning and protocols or in the process of being certified. So these are any restaurants who are following the strict protocols laid out by the government. For restaurants that are not self-certified, they can raise their occupancy to 50%. And of course, curbside, takeout, and outdoor dining is still recommended and encouraged. In addition, all of these locations, regardless of whether you're eating inside now, remember, you still need to wear a mask, and diners need to be a minimum of 6 feet apart for social distancing. Now, in addition to that, there were other businesses who had restrictions lifted. That included personal moving services, gymnasiums and athletic clubs, entertainment facilities like casinos, malls, theaters, those kind of things. They can go to 75% capacity. Now, all indoor major events, they can go to 25% capacity if they can maintain the 6 feet distance. And all outdoor venues can go to 50% regardless of size, again, maintaining that 6 feet distance to try and keep people safe and going on. All of this is possible because the cases of COVID in our area has gone down. Not only is the outpatient positivity rate, hospital rates, and deaths have all gone down. That's all a good sign. At the same time, the number of people across the state who have been vaccinated has gone up as well. So with all that in mind, we still need to be safe, and the governor is still encouraging us all to wear a face mask, hand hygiene, all the social distancing rules we've been doing forever. So please keep that up to make sure we keep on the right trajectory. Now I want to switch and talk about our visitor policy. With the number of COVID cases going down across the board, we updated our visitor policy Monday this week, March 15th. Our old visitor policy was one person per day was allowed to come in between 1 p.m. and 6 p.m. at both of our hospitals. As of this last Monday, we've changed it. Now we can allow 2 people in, only one at a time, but 2 people within a 24-hour period from 11 a.m. to 6 p.m. Now we still have a few areas where we only allow 1 visitor. Those are in the emergency room, ambulatory care, diagnostics, and our OB labor and delivery. In our behavioral health unit, which is called the Center for Mental Health and Wellness, we still are not allowing any visitors in that area for the safety of those patients. If you want to know more about our visitor policies, you can go to WHS.org/visitor guidelines to read all about it. Now, the last thing I would say about the visitor policy is we have made exceptions over time and will going forward for people at the end of life or people who have cognitive issues, disabilities, intellectual disabilities, communication barriers, and behavioral health concerns. And so we want to make sure that we take the utmost care for all those folks and make the appropriate accommodation when we can. We'll continue to do that. Now, let me talk a little bit about vaccines. As of March 15th, this last Monday, there were 3.7 million people across the state who have been vaccinated, which is great. And about 2.4 million of those 3.7 are partially vaccinated. The rest are fully vaccinated. That gets us up to 29% of the total population of the Commonwealth who now have at least 1 dose of vaccine, which is great. The Washington Health System by itself has done over 26,000 vaccines. We've had over 43,000 people request vaccines from us. And so we have a little over 16,000 people still waiting for us to schedule and get them in. Now, you may recall we have 3 locations to provide the vaccine. Down in Waynesburg at our hospital, here in Washington at the Crown Center Mall, and up at Peters Township Rec Center. Those are running sometimes 6 days a week, 8 a.m. to 6 p.m. by appointment only. So, you need an appointment to show up, no walk-ins, no trading, as I said before. So if you have an appointment and now don't need it, you can't give it to someone else. And we're also encouraging you not to come in any more than 10 minutes before your appointment. Many of you are anxious. You're coming in sometimes a half hour, an hour beforehand. Just keep in mind, we're scheduling sometimes 5 and 10 people every 5 minutes. And so if you come in a little early, that causes a little bottleneck. So just wait in your car. When it's time, within 10 minutes of your appointment, come on in, we'll get you done. It's very quick and easy, and we'll get it through pretty quickly. Now, as you heard me say in the past videos, we're only getting somewhere between 3,000 and 5,000 doses per week. I think this week we only got 3,000. And some of those have to be saved for second doses. So you can tell by the numbers, it's going to take a while to get through everybody on the list. And again, we're asking you to be patient. We're going as quickly as possible. We can easily do 10,000 doses per week and probably more. We're just not getting that much vaccine. But we're here, we're getting prepared, and we're ready if we can get more vaccines. Now, you might have heard last week Friday, the governor came out with a new order. The mandate is all vaccine providers across the Commonwealth now, by the end of the month, have to try and schedule, using best efforts, everybody who qualifies for 1A on their list. And the reason for this is they know there's a lot of people anxious, having anxiety about when they're going to get called, when are they going to get in, how are they going to get in. So they want to make sure everybody gets an appointment. Now, it's important to note that does not mean you'll have an appointment by the end of the month to come in and get your vaccine. That just means we're going to try and give you an appointment. That appointment might be for April, May, could be June or July. So we're going to do our best efforts to try and get that done. It's a lot. It's 16,000 appointments to try and schedule in the next 2 weeks is not going to be easy. I'm also a little reluctant to schedule too far out into April and May because there's some indication based on the progress we're making and the quantity of vaccine coming in that there's a possibility the state could go into phase 1B towards the end of April or in May. And so I'd hate to schedule a phase 1A person in late May or June only to find out we're switching over pretty quickly. So we're going to try and balance that as quickly as possible. We'll get to you as quickly as we can. Again, remain patient, and we'll do the best we can, particularly as we move towards phase 1B. Now, remember, it's very important, and it would be very respectful if you could do this. If you don't need the appointment anymore, maybe you got vaccinated somewhere else or you changed your mind, take 30 seconds. Please go to our website, go to WHS/vaccine form, scroll down, you'll find the appointment cancellation form, fill that out. That takes your name off the list. And as you've heard me say in prior videos, there's a few of us, thousands of you. And so if you don't tell us, we're going to spend time and effort to try and contact you, schedule an appointment, only to find out you didn't need it and we've wasted our time. Or worse yet, we get to that date and time and you don't show up because you didn't need it. Now that appointment slot was wasted. The dose won't be wasted. We'll make sure that doesn't happen. But we don't want to waste any minute or second that could have gone to someone else. So please take the time to cancel on our form if you don't need it. Now let me talk a little bit about the state's J&J vaccine rollout. As you know, in the month of March, the state got 94,000 doses that they allocated to school employees. This was both public and private school. And in our local area, the Intermediate 1 did a great job of coordinating this. They started their vaccine clinic with that J&J product last Saturday at California School District, running through yesterday on Thursday. The intermediate unit thought that they could get everybody done who was a school employee who wanted a vaccine through that clinic, particularly because we'd done quite a few of them already. Now that's all the entire dose of J&J that the state's going to get for this month. But starting in April, they're expecting to get around 200,000 doses per week. Now that's not going to be rolled out through the normal process with Moderna and Pfizer. They're going to run some targeted industry groups with some regional vaccination clinics. So in the month of April, they want to target law enforcement, fire department, both employed, paid, and volunteer fire department, grocery store employees. This would include all supermarkets and grocery stores, but it does not include supercenters. So I'm not the one who creates the rules, I'm the messenger. I think that means Walmart employees would not be included, but a Giant Eagle employee would. I need to get more clarification. I'm trying to find that out. It also does not include convenience store clerks, general retail stores that have a small food section, beverage stores, and farmers markets. So I need to get more information on that, but that's coming. In addition, then, the J&J product for April will also cover people who work in the food manufacturing and agricultural industries. And so the list from the state, it's food processing companies that include employees who work at meat, poultry, and dairy processing plants, fresh fruit and vegetable packing operations, food manufacturing, farm workers, farm operations, farm managers, and urban agricultural operations. So all of those folks are going to be eligible for the J&J vaccine in April as part of this targeted rollout plan. Now that does not mean they are phase 1A. So they can't get Moderna and they can't get Pfizer. And it also means the people that are in phase 1A because of age or health condition, they can't get the J&J. These are two distinct rollout plans in two distinct different groups. So a lot of detail yet to come on this, but we're actively working with Washington County and Greene County to try and incorporate that in our operations. We already have 3 great sites that we can ramp up. And so we're working with the counties to make sure when these targeted industry groups happen in April, we can help cover them for the 2 counties to get everybody done as quickly as possible. We're going to have more details on our next video for you about this, so we're working on that as we speak. More to come. Now let me talk a little bit about something fun. If you're looking for a great way to support the Washington health system, we have our upcoming ball. Now last year we did not have the ball because of COVID. This year we didn't want to cancel it again, but of course because of restrictions we can't get a lot of people together in person. And so our ball is going virtual this year. It's called the 2021 WHS Charity Ball Virtual Experience. It's going to be on April 10th on Saturday night. It's going to be a live streaming event. You can get the full details by going to www.bidpal.net/WHS2021. Now, when you go there, you're going to see lots of details about the ball, but that night you're going to see a broadcast that's going to include a great local entertainer, Lee Trebrozik. You're going to see some great stuff about the health system, the foundation. You're also going to see a special presentation to our Distinguished Service Award winner this year, Dr. Mary Jo Perjewski. And you're going to see a spotlight on some other things as well. It's going to be a great evening, great fun, and a nice way to support the system. Now, as part of that, we have some food boxes and some cocktail boxes that you can order in advance. We have a lot of people who are talking about having small watch parties with their family and friends at home. So you can order these boxes in advance to help support the organization, watch the event, celebrate together, those kind of things. You can also get those through that same website I was talking about. Again, it's www.bidpal.net/WHS2021. The boxes will be available for pickup on Friday, April 9th, and also on Saturday, April 10th, out at South Point Hilton Garden Inn. Unfortunately, we can't mail those to you, so I apologize about that. But you can pick them up in advance and then again go home that Saturday night, watch the event, have your snacks and your drinks, celebrate with us in your own unique way. We're really looking forward to it. In addition to the video, there'll be a live auction that night. You can participate. That is also on that same website. You can sign up. It's going to ask for your credit card. It's not going to charge you anything unless you order one of those boxes or bid on an auction item that you win. And while you're there, if you want to give a donation to help support the cause as well, or if you want to sponsor that event, feel free to do that with us as well. We're really looking forward to this event. This will be our first ball converted to a virtual. Hopefully you find it entertaining. We've already got it queued up and ready to go. We had a good time putting it together. Hopefully you like it as well. So that's coming again April 10th. I'm looking forward to seeing you that night. Those are our updates this week. Hopefully you found this worth your time. Thank you for your time and attention. Until our next video on April 2nd, stay safe.